everyone, and I'm Dr. Freddie Gomez, and welcome to another edition of The Doctor is In. This pandemic has made many of us adopt new habits that can protect our bodies from serious health problems. For some, eating healthy and exercising regularly are second nature. For others, it can be a challenging leap to take, especially when you have underlying medical conditions. Today, we will pay close attention to common respiratory illnesses in observance of National Lung Month. Joining us today is Dr. Maria Adelina Sadili. She's a pulmonologist at the Makati Medical Center. It's good to have you again on the show, Dr. Sadili.
Hi, good afternoon, Freddie, and good afternoon to all your viewers. And thank you for having me back again.
Now, yes, now, doctor, there are basically two types of respiratory illnesses in general. Yung tinatawag po nating mga chronic at infectious type of diseases. Let's talk about these during the show. Pero unahin muna natin, doctor, yung mga chronic diseases. What could you explain or give us a background on what these are?
Okay, since we're in the middle of this COVID pandemic, no, may if I may speak in Tagalog also, no, para mas madaming also makaintindi sa atin, no, may dalawang napaka-importante na klasifikasyon ng sakit sa baga. Yung isa tinatawag natin na airways disease, yung mga sakit sa airways katulad ng hika at saka ng COPD na tinatawag, no? And then, yung isa namang grupo ng sakit ay yung mga pulmonary infections. Ang pinaka-importante dito ngayon ay yung pneumonia, no? Yung infeksyon sa baga. So those are two different groups of diseases and very important during this time of pandemic. Freddie.
That's very good. Now, ngayon, since nabanggit niyo po, Doktora, no, umpisa natin with asthma. So, can you tell us about this and how this greatly affects someone's lungs and how this may actually be a risk factor when it comes to COVID-19?
Okay. Ang asthma, no, at saka yung COPD, ilagay na natin sa isang kategorya, no? Ang asthma at COPD, ito ay sakit o kondisyon ng baga at ang apektado dito ay yung tinatawag na airway o yung daanan ng hangin, no? Ang nangyayari, nagsisikip ang daanan ng hangin dahil sa tinatawag nating inflammation. That's why it's called chronic, because there's a chronic inflammatory condition or disease. And kaya ang aming payo, and ito ay nanggaling sa mga eksperto, no? This is from the expert panel of those doctors who comprise what we call the GINA, or this GINA is a group of is our Bible for asthma, and it's composed of experts, no, in the field of asthma. And ang rekomendasyon nila at ang aming rekomendasyon at ina-advise sa mga pasyente ay huwag nilang ititigil ang mga gamot nila sa asthma. Tuloy-tuloy lang, no? And in the same manner, yung mga pasyenteng may COPD, and ang Bible naman namin dito, yung tinatawag na GOLD guidelines, no? And mga experts din yan. And ang rekomendasyon ay ituloy ang gamot sa COPD. Ang sinasabi nating mga gamot dito ay kalimitan or ang majority of the medicines are the inhaled type of medicines, itong mga inhalers nila, no? Sa asthma, ang tawag dito yung inhaled corticosteroids. Sa COPD naman yung bronchodilators. So, huwag niyo hong ititigil.
Okay.
Mm-mm.
Tama po yun, ano? And of course, nandyan din ang pneumonia, no? Which is isa sa mga simptomas din ng COVID-19. Paano ba natin malalaman na, Doktora, kung itong pneumonia ay due to COVID-19?
Ay, magandang tanong yan, Freddie. Alam mo, ngayon, mula na nagsimula itong COVID na to, lahat ng may pneumonia, we have to consider COVID until proven otherwise. That's why ang mga may pneumonia, lalo na yung mga moderate to severe pneumonia, yan yung mga nauospital, ano? At sinisimulan na namin yan ng antibiotics. Pero ngayong during the last few months, no, ng pandemic, madami na kaming mga pasyenteng nagagamot kahit sa bahay. lamang, lalo na yung mga mild diseases o yung mga walang nararamdaman. Minsan may nakikita sa x-ray pero wala pa rin nararamdaman, no? May mga pneumonia. At yung iba naman na may nararamdaman, yung tinatawag nating mild, no? Mild form of pneumonia. Madami na kaming napagaling yan nasa bahay lamang. At yan binibigyan namin ng antibiotics, ng mga iba-ibang gamot, ng mga even vitamins, no, to strengthen their immune system. So, ang pneumonia kasi yan ay infection ng baga, no? And yung virus, nagkukos yan ng pneumonia, and we have antiviral medicines that we give for those who are admitted in the hospital, no? Ang example nito yung tinatawag nating at napaka-famous na remdesivir, no? So ang mga pasyente na may moderate to severe pneumonia at bumababa na ang oxygen sa dugo, no? Yan nagsa-start na kami ng remdesivir, no? Pero yung mga nasa bahay, hindi na kailangan yan. Mm-mm. Yes, Freddie?
Okay, that's very good that you mentioned also some of the treatment options available. Yes, that's good that you also mentioned some of the treatment options available for these respiratory diseases. Now, let's take some time to answer some of the questions we have from our viewers. If you could join us, Dr. Sadili, and answer some of these. We have one. Our first question is from Maya Antonio. Ang tanong ni Maya, ano po ang pagkakaiba ng bacterial at viral infection? Lahat po ba ito ay pwedeng makaapekto sa baga ng tao?
Naku, magandang tanong yan, no? That's a very good question. Madami nagkukos ng infeksyon sa baga, no? Yung mga viral infections, kasama na dyan yung COVID, but usually yung viral infections na mga nakukuha natin nung araw bago mag-COVID, kusang gumagaling yan, ano? Puro supportive lang yung measures niyan. Wala talagang kaming binibigay except if it's influenza, no? Influenza A or B, we're giving oseltamivir for that. Now, itong ating bagong coronavirus, iba na, no? Yun nga sinasabi ko, pag nagkaroon sila ng viral pneumonia, usually malala yan pag viral pneumonia. And in-hospital yan, yung iba na ikakabit nga sa mechanical ventilator, no? Pag talagang oxygen nila ay bumagsak na ng husto at ang pulmon niya ay kumalat na sa buong baga, hindi na sila makahinga, then kailangan ng support. That's why we call it ventilatory support, no? Kailangan silang i-hook sa mechanical ventilator. Ito ay yung para sa talagang may sakit na grabe, no? Yung mga malalala. Now, ang usual na pneumonia na nakikita namin sa clinic or kahit sa ospital, no, ay yung mga bago mag-COVID, no, ito yung mga tinatawag na bacterial pneumonia. Ito yung binibigyan namin ng antibiotics. Ang viral pneumonia, hindi pwede ang antibiotics dahil ang antibiotics para sa bacteria. So magkaiba yon, ano? So ang antibiotics ay para sa bacteria lamang, hindi para sa virus. That's why yung mga may flu, ganyan, hindi kailangan mag-antibiotics sila kasi hindi naman tatalab yun sa virus. So yan ang pagkakaiba niyan. Mm-mm. Yes, Freddie.
That's right. So napakaraming talagang pwedeng makaapekto sa ating baga para humina ito. That's why when we return, we will talk about taking good care of your lungs. All of that when the doctor is in return. We'll be right back. Thank you very much for joining us here on The Doctor is In. I am Dr. Freddie Gomez. With every breath we take, our lungs provide life sustaining oxygen to the entire body. When we exhale, the lungs expel carbon dioxide, which is a byproduct of our respiratory system. Now, the ability of our lungs to breathe in the good air and breathe out the bad or unneeded air affects our overall well being. And we are joined today by pulmonologist Dr. Maria Adelina Sadili. Now, Doctor, continuing with the discussion, what are some of the most common causes of one of the symptoms, one of the more common symptoms of COVID-19, which is breathing difficulties? Marami talaga ang nakakaranas nito, no? Aside from the minor symptoms, they can even experience breathing difficulties when they have minor symptoms. What could be some of the more common causes of this?
Okay. Dun sa mga may symptoms, no? Those who have symptoms and are affected by the COVID virus, no? There are two main causes of breathing difficulties. No? Number one is, of course, the presence of pneumonia, yung infection sa baga, which can affect the oxygenation, no? Yung pagpasok ng oxygen sa katawan or sa lungs. No? And number two, and ito yung kailangan talagang bantayan, lalo na dun sa mga severe, yung tinatawag naming blood clots or yung mga nagkakaroon ng embolism, no? Because pag yan pumunta sa lungs, no, yung blood clot na yon, talagang maaapektuhan ang pagdaloy ng oxygen, hindi magiging pantay ang pagdaloy ng oxygen at dugo. So hindi mapupunuan ng oxygen yung dugong dumadaan sa baga. At paglabas ng dugo sa baga at bumalik na to the rest of the body, walang bitbit na oxygen. No? So those are the two very important factors causing the difficulty of in breathing of our patients who are affected with COVID.
Ngayon, Doctor, bukod sa mga infectious diseases that you mentioned, ang baga po ba natin ay nag-iiba rin habang tumatanda ang isang tao? Can the function of the lungs also be more at risk, or can it deteriorate as one purely becomes older?
Yes, oo. Para din kotse yan, habang tumatagal, pumapangit ang andar, no? Ang mga tao, hindi lang yung lungs, lahat ng sistema natin tumatanda. Now, when our lungs age, we don't just look at the lungs itself, no? May mga ibang kapitbahay yung lungs, which affect the function of the lungs as we grow old. Ang isa na nito ang mga buto, no? Our bones. Remember that our lungs is enclosed by the ribs. The naka-enclose yan, and the ribs are very important in inhaling and exhaling. So pag tumanda na tayo, osteoporotic na yung mga ribs na yan, yung mga buto na yan, numinipis na, hindi na makasuporta sa lungs ng katulad ng bata pa tayo. So humihina yung pag-inhale, exhale. Number two, muscles, including our diaphragm. Yung diaphragm ay yung muscle between the chest cavity and the abdominal cavity. No, so yung mga muscles na yan, no? Yung mga muscles na yan ay naaapektuhan din habang tayo tumatanda, humihina. So lahat-lahat yan, if you put everything together plus the aging of the lungs, nagiging less elastic na yung lungs natin. Pag tumatanda tayo, parang lobo, no? Yung lungs. The lungs are very elastic, no? But as we age, hindi na siya ganun ka-elastic. So if you put all those things together, elasticity of the lungs, the aging bones and the muscles, and even our coughing, no? Hindi na tayo ganun kalakas umubo pag tumatanda na tayo. So our clearance of secretions, hindi na ganun ka-effective. Plus, yung hindi natin nakikita, yung immune system natin. Pag tumatanda tayo, it's not as robust anymore as when we were younger, no? Or when we are younger. So even the immune system gets old. So mas prone tayo sa mga infeksyon. So pag pinagsama-sama mo lahat yung factors na yan, the aging lungs, we have to be kind to our aging lungs. Therefore, kung maiiwasan natin ang mga factors na nakaka-stress sa lungs, number one dito ay paninigarilyo, no? So kung maiiwasan natin yan, it will help a lot so that as we age, yung lungs natin can still function as well as when we were, a little younger. And ang isa pa dyan ay exercise, ha? We have to start a good exercise program, a good aerobic exercise program para gumanda ang pagdaloy ng dugo, no? It improves circulation, and therefore if you improve circulation, you improve oxygenation of the body. So yun ang masasabi ko. Mm-mm.
That's right, That's right. So our lungs need daily care and attention no matter what the circumstances. Huwag po natin kalimutan yan. Doctor, may mga tanong tayo from our audience. This question is from Allen Alzola. Ang tanong ni Allen, can you share some simple exercises that are good for the lungs? May mga breathing techniques din po ba?
Yes. Okay. Okay, very very nice question kasi very practical 'yan, ano? At lahat ng tao pwedeng gawin 'to. A simple aerobic exercise. Yung aerobic, hindi yung aerobics na pinupunta natin sa gym, no? Pero pwede rin 'yon. Pero to start, kung kunyari hindi kayo nag-exercise pero kailangan gentle ang pag-progress ng exercise, dahan-dahan, 'wag yung bibiglain, ha? So, ayan, yan, ginagawa niyang nasa TV, okay yan. Pag talagang matagal na kayo nag-exercise. Pero simple calisthenics, yung ginagawa natin nung grade school tayo, nung elementary, simple calisthenics, simulan nyo yon, that's going to be good. Now, breathing exercises, anong ibig sabihin nun? Hindi pwede yung hinga, labas, hindi ganon, no? So, ang effective na breathing exercise is you take a deep breath. Ha? Pupunuin nyo yung lungs nyo ng hangin, ng air, no? And then hold your breath at the end of inhaling. You count 1 to 10, 10 seconds, kung pwede, kung kaya nyo ng 10 seconds. But hold it as long as you can. And then when you breathe out, you breathe through pursed lips, parang sumisipol, no? Ganon, dahan-dahan. Huwag yung i-inhale, tapos hindi pwede yon. Iipit yung hangin sa loob ng baga, masakit sa dibdib yon. So you take a deep breath, hold your breath for as long as you can, and then sipol palabas. That's what I teach my patients. No? So I'm sharing that with you. And that will be very effective.
That's right. And a reminder for all our viewers, for those especially with breathing problems, you must consult your doctor first before starting any type of exercise. Thank you very
Mm-hmm.
much, Dr. Sadili, for all your input and all your expertise. Very practical advice also for our viewers.
You're most welcome.
Now we have to pause for.
And one way we could use this time is to focus on our home and ourselves. When we come back, we will give tips on how to reorganize your home by decluttering for a healthier lung. Stay tuned to the Doctor's In.
Hi, I'm Dr. Freddie Gomez, and welcome back to The Doctor is In. There are not many things to do these days, but why not try something productive? And like setting your sights on tasks that you have avoided for the longest time, something like decluttering. To help us with ideas on how to start cleaning up, we have with us blogger and professional organizer, Miss Issa Reyes. Thank you for joining us, Issa.
Hi, Doc. Good afternoon.
Now, Isa, why should we declutter our homes? What are the benefits of decluttering?
Um, for me, I think the benefits of decluttering is being mindful of the things that you own, and understanding and having ownership of the items that you actually have at home. Because most of the time, the items that we have around control us, where it should be the other way around, that we are supposed to be the one in control of our things.
That's right, I know. And the less clutter we have, definitely the less dust, the less things that are there to irritate our lungs. So there's a healthier aspect to this as well. But as decluttering can be fun, it can also be overwhelming. And hindi ba, Isa, no? At marami sa atin ang hindi alam kung saan at paano magsisimula. Can you give us some tips on how we can declutter for our homes? Where can we start?
Actually, Doc, I created a technique mostly suited for Pinoys because we are highly emotional individuals. And um, with the technique that I created, I call it the homeward technique, where the first step that you need to do is sort your items first without throwing anything yet. Because if you sort your items, somehow it will give you a more visual understanding of how much items you own. If you put all like items together, then the process of elimination is easier rather than actually doing it one by one, asking yourself if you need it in your life, if it really does make you happy. It's kind of it's a very emotional process when you do decluttering that way versus doing it more objectively, which put all like items together first and have an understanding of why you have so much of certain things.
Okay, I think that's a good way to start to put the items into like piles, so to speak. Now let's answer some
Mhm.
questions from our audience. Maraming questions na mga pumapasok. Mukhang marami talagang gustong mag-declutter din ng bahay nila. We have one from Grace Buenaventura. Ang tanong ni Grace, how can you maintain a clean space after decluttering?
For me, it's really important for you to create zones, or as I call it, specialty areas. Because if you know where your items are, if you have identified certain areas in the house that really and create a category about it, it's easier not just for you to follow, but also for other people who's living with you in the house. So if you know where to put certain items because it's classified and it's categorized already, then it's easier to maintain.
Okay, so try to be organized is very helpful there. We have another question from Jing. Ang tanong ni Jing, I have children at home and it's so hard to keep my house clean. Anong strategy na pwedeng gawin? That's a very practical question, lalo na sa mga may mga anak sa bahay.
Yes, it's either you involve your kids also, let them decide which toys they would like to keep and the toys that they would like to play with. Toys on rotation is actually a good idea where you only put out toys, I mean, certain toys that could be their flavor of the month or flavor of the week. So that usually kasi kapag bata, di ba, parang if madami masyadong options, instead of really playing with it, they're just going to remove it and, kalat lang talaga siya sa buong bahay. Whereas if you only have like a few options for them to play with, then they will have more interest on the toy and at the same time will help you manage it better.
Very good. And we have another question from Miko. Ang tanong ni Miko, I'm a sentimental person. What can I do need but mean a lot to me?
Okay, you know what? I don't really advocate on one thing. I don't advocate on just minimalism because I really understand how Pinoys are. I understand how sentimental we could get. But then again, based on the technique that I shared with you with the homework technique, it is with sorting that you understand what really is important. Because I think if you treat everything as sentimental, then nothing is. Wala nang importante if lahat sentimental. But if you have an understanding of what items you own and what really is important, then you can put more value on the things that matters to you. So I think at the end of the day, it's really identifying which works for you and which really holds like a certain importance and value to you.
There you go. Very important tips on letting go with those sentimental things. Thank you very much, Isa, for sharing your
Thank you,
tips
Doc.
on decluttering today. And thank you also to our viewers for joining us today. Remember, Taking care of our lungs, especially during this pandemic, is a very important part of maintaining our overall health and wellness. And while we try to keep our minds and body healthy during the quarantine, we might as well try to start organizing our homes. A clear living space is good for your head space as well. This is Dr. Freddie Gomez again saying see you next time on The Doctor is In. Stay safe, everyone.